So let's go on to the third topic, and that's COVID-19, the virus that has plagued us for the last 2 years. In fact, some real good came out of that for us, and that is we switched to an internet-based telemedicine program, which is far more beneficial and enjoyable. We get better results over the internet than we did by locking people up at a resort in Santa Barbara, California. So some good things came out of that. There's some very terrible things that came out of it too for most people. So I'd like to talk to you about viral infections in general and COVID-19 particularly, and the influence diet has. Before the virus escaped from China in 2019, the Chinese doctors had observed that many people who got this virus did just quite well. They were either asymptomatic or had mild disease. And then there were people who got really sick. They had to go to the hospital. They were put on mechanical ventilators and essentially drowned in their own fluids for the next 2 weeks before they died. They knew that before it came to the United States or Europe, that it was comorbid factors, the ones that I have treated as a medical doctor. It was the obesity and the heart disease and the kidney failure, the diabetes. These are things that the approach I use cures. But when you have these things, then you're not set up to defend yourself from this virus. The Center for Disease Control and CDC, Center for Disease Control and Prevention, their findings were this, and this was back in July of 2020, maybe it was May of 2020. They came out and they said that if you have comorbid factors, which are obesity, diabetes, high blood pressure, heart disease, the things you get from being poisoned by the rich Western diet, then you have a 6 times higher rate of being hospitalized and 12 times the risk of dying. This again is a fact, not with any contradiction. As far as Europe goes, they have come to the same conclusion as we did here in the United States, and that is that if you're going to survive this viral infection, you're going to stay out of the hospital, you're going to stay off a ventilator, you're going to keep from dying, you need to take care of your health. And probably long before you got the infection, you should start taking care of your health. So again, this is a worldwide understanding of the importance of diet when it comes to viral infections. But what does diet do? It does all kinds of things. And, I don't know what they all are, but I know of a few of them. That's not really important. When you eat the rich Western diet, you suffer from food poisoning, and a whole bunch of the systems don't work very well. One of the thoughts has been that when you eat an unhealthy diet, and you hear a lot about this these days, people are talking about the microbiome, the intestinal bacteria, and how important they are. When you eat an unhealthy diet, what happens is you grow bacteria that destroy the integrity of your intestinal tract, so the virus more easily passes to your tissues. Now, that's one theory. Probably true. I would say it's true. The other thing that we talk about in terms of viral infections and cancer, et cetera, you probably heard a lot about this in the conference so far, are the importance of plant nutrients, phytonutrients. Well, I think they're really important too, as long as they stay in the plants. I think you take them out of the plants and you put them in bottles, I think you've lost it. Profitable, but you've lost it. So maybe it's the phytonutrients in all of our plant foods, in plants, in fruits and vegetables and starches. Maybe that's a big part. I think so. And one of the interesting findings was the role of cholesterol. Remember, we dropped cholesterol in 7 days, 22 milligrams per deciliter. We unburdened the body of cholesterol just with diet. Some important research that came out showed that cholesterol was integral in allowing the virus to be highly infectious and damaging. And what they discovered was there were bridges that allowed the virus to come through the one cell membrane that separates the blood from your tissues. And these bridges, they're ACE tubing bridges. And what happens is the COVID-2 virus, it goes through these rafts, these lipid rafts, these ports to get through into the bloodstream. And the bridges are made wider and more common if you have a high burden of cholesterol. The medical profession really jumped at this one, and they could understand it. Doctors understand drugs. And so when the research came out that taking statin drugs would reduce the risk of dying in severe disease by 30 to 50%, doctors understood, because they were dealing in an area that we are so expertise in, and that's drugs, medications. But the right way to do this is to lower cholesterol by changing your diet. And you know that cholesterol is only present in animal foods to a significant amount. And I showed you we dropped the cholesterol in 7 days, more than 20 milligrams per deciliter. And people maintain these drops for over a year. They unburden their body of cholesterol that opens the bridges that allow the virus into the body. All right, so I've talked to you so far about chronic diseases, diabetes and high blood pressure, obesity, cancer, heart disease, and so on. And I've just started to introduce you to the idea of climate. And we've talked about, and you've experienced it in the last 2 years, what ravage can occur worldwide from a viral infection, and how important it is in all three of these areas to eat a good diet. The question that comes up now is, will people do it? Will they do it to prevent themselves from getting really sick when it comes to a virus? Well, how about will they do it to stop their diabetes, reverse their heart disease, have a good bowel movement, relieve their constipation? Will they do it? Well, I don't know. I've been trying to get them to do it for a long time, but with some success, a lot of success. And how about when it comes to saving the planet? Will we do it? Okay, are we able to make that kind of change? Because knowing all this information doesn't do us a whole lot of good, does it? Unless we're willing to do something about it. Well, I'm here to tell you, we have the potential to do something about it because we've done it in the past. We've changed. Millions of people have changed when it was necessary, and we could do it again. This comes out of World War I. During World War I, a big battle was between Britain and Germany. And the people in England set up the British blockade in the North Sea, which was essentially to stop importation of anything to Germany. It was very successful. But unfortunately, other countries, they were involved in this blockade also, like Denmark. You see where Denmark's located on the map? And so Denmark was in big trouble. Well, the Danes, they changed their diet. And as a result of changing their diet, they went through this period of time without suffering at all. In fact, they benefited. Whereas the Germans, who stayed with a well-balanced diet, made sure they got enough meat and dairy, even though there wasn't really enough. They starved to death. In fact, 400,000 Germans died of malnutrition during that period of time. So what did these Danes do? Well, they were under the leadership of a very famous doctor, Mackey. Mackey, by the way, he had come to the conclusion, as other scientists did at that time, come to the conclusion that the need of protein in the human being is so low that it never has to be considered. It's impossible to design a protein deficient diet. They knew that 120 years ago. Well-educated people know that again today. It's impossible to design a protein deficient diet. So he didn't have any hesitation of asking his fellow countrymen, 3 million of them, to stop eating the animals. And instead, he asked them to eat the foods the animals were eating, and they did. The potatoes, the grains, the soybeans, yeah. In Denmark, the pigs died of starvation, but people received adequate nutrition, he said. And he also said that the starvation in Central Europe wouldn't have happened if they would have adopted similar principles. Mikhail Henhede. His work was published in the Journal of the American Medical Association in 1920. You can read the article. It's freely available on the internet. And in this article, you'll find the publication of what happened to the Danes during this period of time, during World War I. Thrived. They had better health during this period of time than they ever had before World War I or after World War I. There was a 34% reduction in death overall. You can see the chart here. I want you to notice also the purple line. Even infections, death from infections went down. Well, at that time during World War I, same period of time, we had the Spanish flu. You remember? You learned it in history. Sure you did. About how 50 to 80 million people died worldwide from the Spanish flu. And they had low-tech, the same effective methods of dealing with it that we have now. Nothing's really progressed as far as these low-tech methods of wearing masks and social distancing, washing your hands. Look what happened to the Danes during that period of time. They had the lowest death rate from Spanish flu of any European country.